Hi everyone, I'm Tim Light. Welcome to Debunked. COVID-19 is hitting Utah. This pandemic is affecting us all, so we decided to hold this emergency episode about the resources available to us to prevent the spread of COVID-19 and, to keep ourselves and one another physically and mentally healthy during this tense time. So today we have joining us Dr. Sandra Solzer, Heather Bush, and Hillary Deesh. Sandy, do you want to give us an introduction first?
I'm Dr. Sandy Solzer. I am the Director of the Office of Health Equity and Community Engagement at Utah State University, and I'm the Project Director of this podcast, Debunked, and I'm on the Public Health faculty at Utah State University. So my hope is that this team of experts coming together today can speak to everyone to calm any fears or panic and also give some helpful tools so you can be informed and debunk any myths that you're hearing about COVID-19, especially as it pertains to some of our most vulnerable populations.
Great. Thank you so much. Heather, do you want to give us a little intro? Heather was on our show before, but in case anyone forgot.
How could you forget me? This is Heather Bush. I am the Syringe Exchange Program Coordinator for the Utah Department of Health. And I'm here today to talk about some harm reduction-related issues and how we can help protect some of our most vulnerable populations.
Thank you. Thank you so much for being with us today. And then Hillary, can you give us a quick little intro? Hillary's on our editorial board.
Hi, everybody. My name's Hillary Deesh. I'm on the editorial board of Debunked. I do a lot of writing and communicating about harm reduction, and now I'm having to do some writing and thinking about COVID-19 and how that applies.
Thank you. I really appreciate you all being here on the show today. I forgot to mention, our audio might sound a little funny on this episode because we are recording this episode remotely, so none of us are in a studio together. We're all calling in to the studio to record this because right now with COVID-19, it's really important that everybody practice social distancing to stop the spread. And we're going to talk more about that throughout this episode. We wanted to make sure that you all understood that we're not sitting in close quarters in a little studio, coughing on each other and things like that. So what is COVID-19? So the coronavirus, I just thought I would give a quick little definition of what COVID-19 is as it is listed on WHO's website, the World Health Organization's website. So coronavirus viruses are a large family of viruses that cause illness ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome or MERS and severe acute respiratory syndrome like SARS. Coronavirus disease, the COVID-19 strain, is a new strain that was discovered in 2019 and has not been previously identified in humans. I'm sure most people are aware that the common signs of infection include respiratory symptoms, fever, cough, shortness of breath, and breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Standard recommendations are, we're going to talk about these on this episode, but, just to prevent the spread, we need to wash our hands and cover our mouth and noses when coughing and sneezing, thoroughly cook meat and eggs, and avoid contact with anyone showing symptoms of respiratory illness, such as coughing and sneezing. So Heather shared with me 3 documents. Heather, can you tell us where those documents come from? And then there's a statement in the one that is syringe services and harm reduction provider operations during the COVID-19 outbreak. That one, I wanted to ask you a question about that. So can you tell us about the 3 documents really quick?
Sure. So the National Harm Reduction Coalition, in conjunction with several other professional agencies, has put together some advisories, both for people who are providing syringe services and other harm reduction services during the COVID-19 outbreak, and also for people who are currently using drugs and some tips on how to lower their risk. So it's both for providers and participants or clients or people who are currently using drugs. So those 2 resources, then also SAMHSA, the Substance Abuse and Mental Health Services Administration, the national organization, has also sent out another fact sheet regarding some concerns both for people who are working in perhaps drug and alcohol treatment facilities, substance abuse treatment, their clients and patients, as well as addressing some of the issues of people who have, who are already prone to having a lot of trauma, substance abuse issues, mental health issues, trying to help them kind of cope, as we all are, with some of the stress and the fears that come from this, and people who are in residential facilities that are somewhat trapped and in perhaps close quarters. That can be an additional fear for them.
Gosh, thanks so much. So these 3 fact sheets will be up on our social media at DebunkedPod for everyone who listens to this to be able to, get that information. So we have some myths that we want to address. The first big one is that we keep hearing is this virus an Asian virus? Are Asians more susceptible or something like that? Dr. Solzer, do you want to give us your comments on that myth?
So I have heard people use the term Wuhan virus, and there might be a perception out there that a certain racial group is, more prone or less prone to contracting this virus, and that's a complete myth. There is no evidence whatsoever that any one group is more or less likely able to contract the virus. It doesn't matter who you are or where you're from. The virus doesn't discriminate. The idea that, you can avoid the virus by avoiding Asian establishments is completely inaccurate.
Thank you. Hillary, the myth that this is an Asian virus and that...
This myth, it's racist for one thing, and I think that now it's an especially dangerous time to buy into these racist notions because people are experiencing a lot of isolation and fear anyway, and we should be doing what we can to show each other emotional support however we can, whether that's through phone calls or digitally or, if we have a blog or whatever, and not continuing to marginalize particular groups of people. When Sandy mentioned that the COVID-19 doesn't discriminate, it made me think about what harm reductionists and including the harm reductionists on this podcast, we always say that drugs, whatever kind of drug, that also do not discriminate, and that we need to really show some compassion right now.
Yeah, totally. So, Hillary pointed out that because of the social distancing and the need for us to do that, there's some isolation going on. And, one of the myths we keep hearing is staying home or changing your daily behavior is probably a waste of time because everyone's going to catch the virus anyway. What are your guys' thoughts on that myth?
The idea that one person can't make a difference by staying at home is deeply problematic. It is possible that over a very long period of time, many or most of us may catch this virus. However, our hospitals or ICUs have a limited amount of capacity, and what we've seen is that this virus spreads exponentially. So for every one person who stays home, right, and doesn't catch the virus and doesn't transmit it, I want you to think about your staying home as your ability to help prevent 10 other people from becoming sick. That's how quickly this is moving, and that's the shape that it's taking. We've also seen data from South Korea where they were widely testing people who showed even mild symptoms. And we found 20 to 29-year-olds who were mild carriers who weren't experiencing many symptoms were the ones most likely to be passing along the virus. So the severity of your symptoms is not a perfect indicator of whether or not you can make someone else sick. The truth is that many people will transmit the virus unaware that they have it. And so, yes, eventually we may achieve herd immunity, which is when 40 to 70% of the population has experienced the virus and it's less able to transmit. But right now our immune systems have no response built up for it. Our society, collectively, we don't have any immunity toward this. And it's growing at an exponential rate. So if you stay home now, does that mean you might get sick in a couple months if you go back outside? Of course, you could. But what you're doing is you're decreasing the level of crisis in our urgent care centers and our ERs. And also, it's not just that COVID-19 is happening, right? All of our normal health issues and chronic health conditions still exist. And so we want to save any medical resources available for people who are in dire need of them. So the best thing you can do is to think of yourself staying home as preventing 10 people from getting sick.
Gosh, that's powerful. Heather, how are you experiencing this at the Department of Health?
Well, our team has been amazing at their response and their round-the-clock dedication to answering questions and trying to direct people in the right direction. And I wanted to make sure, and I'm sure you guys will post this, but coronavirus.utah.gov is such an excellent resource. It's very up-to-date, and it is a Utah-specific resource, so you can get Utah-specific things there, but then they also link to CDC and national updates. And there's resources and hotlines and, frequently asked questions, suggestions, all sorts of things on there. It's a really, really great resource. And things are starting to, I wouldn't say get under control by any means, but I think, like Sandy was saying, by everybody doing their part, sometimes we feel like, well, what does one person matter? What does one thing matter? And I saw a really powerful meme or picture about this that I'll try to describe, but it had a row of matches, and like the first 5 were all burned, and then there was one match that was removed, and then the other matches were not burned. So it kind of showed how by just that one match being out of place, it prevented the spread of that burn. And I thought that was really powerful just to kind of realize that. And like Sandy said, it's passing it to other vulnerable populations. And also keeping ourselves healthy, keeping our immune systems healthy, keeping ourselves away from other people, washing our hands, disinfecting surfaces, things like that. That helps keep us healthy so that we're not then getting the flu or getting the flu and passing that to somebody else, or, things like that to consider. So, and really, if people look at this isolation, and isolation sounds so sad, but this social distancing and just kind of staying at home for those who are able, it helps those who are not able, those who don't have choices. My husband works in a grocery store, and he has to go to work to help make sure people are getting food. But that also means that he's then exposing himself to thousands of people every day. And he's risking himself to take care of everybody else. He's doing, of course, what precautions he can. But then I have the ability to work from home. So let me, take myself out of the equation since he can't. Things like that to consider, and to look at it really as it's just a way, it's something that we can do. It's not that people are trying to take away your rights or people trying to tell you what to do or overreacting. I also saw somebody said, well, let's overreact and then see what it does, as Sandy mentioned, to kind of just slow down that spread and not burden our health systems. And then, I would much rather overreact and have it not be as big of a problem. And it's not going to be as big of a problem if we overreact, if that makes sense.
Yeah, and I think the fact of the matter is social distancing isn't overreacting, right? I mean, it's completely necessary to stop the spread of this virus.
And it's super easy to do. It's super easy to do. Yes, you may have to go to the grocery store, but stand far away from people. Wash your hands. Wash your hands as soon as you get home. Don't touch your phone. I was thinking about this today. Don't go to the grocery store, touch a cart, then touch your phone, and go home and wash your hands, and then touch your phone again. Try to think about things like that. And again, not to be paranoid, but the more caution, because there's so many unknowns and so many things we don't have any control over. Let's take control over what we can.
Yeah, and we're going to talk more about taking care of our personal mental health during this time, because it is, for me, it's been pretty easy to self-isolate, not to self-isolate, to social distance, because I can stay with my family, right? But for those who are single, or live far away from their family and they can't get there, or, what have you, all the spectrum of different relationships that we see, gosh, I can imagine this is even more trying of a time. Hillary, I wanted to ask you really quick about, in terms of harm reduction, what are the specific advice that are being given to individuals who are utilizing harm reduction practices at this time?
Sure. I'll start sort of with the precautions, and then I'll sort of go down to some specific pieces of advice. So I believe that people who work in harm reduction, really, everybody I've met in the harm reduction community does this work from their soul and with a lot of love. It's the type of work that is always going to be personal in one way or another. And it's heartbreaking to not be able to give somebody a hug because you might be the only person who bothers to embrace, somebody who's using drugs or unhoused. And in terms of continuing to get people the medication that they need, HIV medication or medical-assisted treatment, so people who are recovering from opioid use disorder using things like buprenorphine. Obviously, always use clean syringes. Use them only one time. If you're an injection drug user, never sharing, of course, carries the risk that many of us already know about, which is HIV and Hep C transmission. But now, of course, it also there's the additional weight of COVID-19 that can be shared via sharing syringes. And a lot of people who use drugs have compromised immune systems in one way or another, and so COVID-19 can be especially serious. The people who are unhoused, people with substance use disorders are at a much higher risk for the most severe symptoms of COVID-19. If you are snorting drugs, not sharing whatever you're using to snort a drug, using color-coded straws, for example. So if you're, hopefully you are not in close enough proximity to have that confusion, but a lot of people don't have the option of social distancing if they're living outside. They're using color-coded straws, not using things that might be contaminated, such as dollar bills or Post-it notes. Those can carry bacteria, including the virus. So a lot of things that people who are not in harm reduction, like in the harm reduction field, they might not think about. And then safer smoking. Now is not the time to pick up cigarettes from the street or share cigarettes, which is so common, of course, because people are generous and they want to share. So not sharing cigarettes, using pipe covers if you are smoking meth or crack cocaine, making sure everybody has their own pipe cover, everybody knows, which one is theirs, and that you're not sharing. So those are some, I'm sorry, this was a bit long-winded, but those are some of the precautions that we're talking about.
Gosh, thanks, Hillary. As you were talking, I was like near tears thinking about the people who, don't have anyone in their life and they need a hug that day and they just can't even get a hug. And it sounds so simple, but it can be so, shattering in that moment.
Yeah, and to add, a lot of people don't have regular internet access either. So, I can call you or Heather or Sandy to talk, to chat, but, a lot of people don't even have internet access, might not even have a phone. So it's hard, but, right now it's just about containing the virus, trying to ensure that it doesn't reach the most vulnerable people. Yeah.
Gosh, yeah, thank you. So like Hillary said, she said you need to minimize the need to share your supplies. So don't share cigarettes, don't share pipes, don't share bongs, whatever is your supply, don't share that. Minimize that sharing. And then a couple other things that were mentioned were prepare your drugs yourself, which I thought was wise. And if you can't prepare them yourself, you need to watch the person who's preparing them. And then plan and prepare for, extended time in a home, which could mean that you need to plan and prepare for an overdose and things like that to have naloxone and other things available. So, Heather, do you have any comments on those things that I just said?
No, thank you for what you said. And Hillary, those are some excellent tips. And I think one of the things is this is what harm reduction is made for. Harm reduction is about reducing the harms associated with drug use. But also harm reduction means a lot of other things, right? So what we're all doing here with social distancing and washing our hands and all that, that's harm reduction for COVID-19 risk. So I think in some ways it's like, I think somebody said harm reduction is built for this. And I think just really super encouraging. And I hope that if some good comes out of this, that it does kind of re-encourage and excite, maybe that's the wrong word, but maybe just focus people's attention on the importance of these things all the time, but in addition. But I think it's also important, like we were talking about earlier, to not then turn that around into I'm protecting myself because I think you're dirty or I think that you are going to transmit it. I heard somebody say, too, we should all just assume that we have it. Like what we were talking about earlier, that many people are carriers and may have very few symptoms or very mild symptoms and don't realize that they're transmitting it to more vulnerable people. So if we kind of act like we all have it and we don't want to carry it to other people rather than looking at, I'm protecting myself from other people, or even if we do, it's just because we're all in the same boat, instead of that it's any one group or anybody who's at any higher risk. This disease truly does not discriminate based on anything other than human contact or human being near each other. So I think those are some good things to remember. And I really like all those tips and suggestions. And I think it's also, this other fact sheet and the other things to think about. And I've been talking a lot with my providers about how they protect themselves, because they want to be out there and taking care of their clients. They recognize that if they stay home and they're not providing people with harm reduction and syringe exchange services, the clients are not getting those. And those that are already so isolated, not having interaction or information or support, that could lead to a ripple effect of other problems. So it's important for them to stay operating. They just need to alter their operations. And some of the providers here in Salt Lake City, like they've suspended HIV and Hep C testing efforts. They are like pre-packaging kits instead of letting people like pick up items kind of like buffet style. They're, obviously keeping 6 feet or more distance, which does create that sad feeling of I can't touch you or hug you or give you a handshake or anything. And they're obviously sanitizing their surfaces and all of that. But, it's a challenge for them because when people are stressed and worried and all of that, but they want to make sure that they're still getting those services out to the clients the best way they can, and making sure that people have naloxone, making sure that people are considering those other things and they're not getting desperate and worried about drugs running in short supply, so they're taking more or anything like that to just add on top of the problems. And as always, of course, we don't want anybody to have any medical problems or overdose issues, but also because of medical resources are limited and already taxed. And so that's another consideration as well.
So thanks, Heather. I wanted to go back to what you were saying about harm reduction. All the things that we are doing right now, we're practicing harm reduction. And harm reduction, like we talked about last episode, is all about compassion. So I want to talk a little bit about the mental health strain that some individuals might be experiencing and how we can compassionately reach out to them, as a form of harm reduction. So, Dr. Solzer, what are your thoughts on, things that we can do to help alleviate the anxiety, the potential side effects of social distancing and things so that that's not harmful as well?
So I think importantly, when we say social distancing, we truly mean physical distancing. We don't mean actual social distancing. So, I personally, what I've taken upon myself is that every day I reach out to at least 2 people that I know of in my network who might be vulnerable or might need additional help. And whether that's someone who is a little bit older and higher risk, for example, I have an aunt in her 80s, if I can go to the grocery store for my aunt and I'm lower risk, that can help protect her. And in addition, research has shown that volunteering and service to others is a natural counterbalance to feeling isolated and alone. So if you're feeling signs of hopelessness, you're feeling really down, you're feeling isolated, this is an opportunity to reach out and help others. That is a huge deterrent to some of the mental health effects you might be experiencing in isolation. Just because you can't physically be around people just means you have to put more energy into making sure you're doing video calls, you're checking in on people in other ways, you're looking into online groups that you can chat with or hang out with virtually. And also I wanted to mention that in Extension we're launching a program specifically geared toward this right now. So if you are isolating at home and you're feeling disconnected from your community, we have a program called the Master Health Volunteer Program, and the education for it is online. And the entire curriculum teaches you about health and wellness with an end goal of supporting you to return volunteer hours in your community. And it's true that COVID-19 is going to shape how we do our volunteerism. We're obviously not running big events or youth camps or something like that right now. But we all have elderly in our community. We all have people who lack housing in our community. There are many vulnerable populations that we can be supporting. And the way I think of it is I'm one person. If I reach out to just 2 people a day as my minimum, right, that's 3 people if you include me who every day are going to be a little bit healthier through this. So the Master Health Volunteer Program, we will link to it on our podcast page. But you can also, if you're just listening to this right now, just Google Master Health Volunteer, USU, and you'll be able to find it. And it's an online course. And right now we're waiving the fees for people to enroll. So you'll get 40 hours of education that's holistic health focused. It talks about spiritual wellness, financial wellness, every area of your life, environmental. You can find an area that you're interested in or passionate about, and then we'll support you to find a way to return volunteer service to your community in exchange for taking the class. So that's one small way we're trying to help people find ways to connect to each other. I know, for example, in Salt Lake City, you can sign up to volunteer at the food bank. They're just requiring you to sign up in order to space people out so that we can practice social distancing even in our volunteerism. But I think it's a really important time for everyone to take a hard look at themselves and the resources that they have and to think about how they can support others. That's the best antidote I know of for not feeling alone while social distancing.
Thank you. Heather, do you have any thoughts on that as well?
No, I love that. Those are such good ideas. And I think that's something that people forget about is that stress is one of the hardest things on our own immune system. And often we do feel helpless, that there's nothing that we can really do. And I think helping other people, even if that is by a quick phone call and check-in, if that's running a quick errand for your elderly neighbor, if that's, any of those things, I think can really help us, because those of us who aren't probably in the usual risk group, we still need to do what we can to keep our immune system strong, keep ourselves mentally healthy and strong so that we can help others. And I think also just continuing to spread the word of, love and compassion and community and support. And I know that sounds kind of cheesy and whatever, but I think any positivity that we can keep going out there and, reaching out and supporting. If you know somebody who's a bartender or a server or a cook that's now no longer able to work, what are some things that you can do? I know that there's some companies like grocery stores that are actually hiring right now because they need more help. So, looking for ways to help, and then that makes us all feel better. And it just does have a ripple effect in the same, it spreads just as easy as the virus.
Oh, I love that. Harm reduction done right spreads just as easily as COVID-19. Hillary, do you have any thoughts on what Heather and Sandy were just commenting on?
Yes, I think all of their advice is really good. Kind of going with what Sandy was saying about the research that's been done on service and volunteering, helping to counterbalance feelings of isolation and loneliness. I think that's really true. I know that from personal experience. I do think that most people want to feel useful, and I think that I suspect that part of the reason that people are going to have such a tough time with social isolating is that there's nothing, they don't feel tangibly that they're being useful, even though, of course, social isolation is the most useful thing right now. But I was brainstorming about this today because at my job we really rely on volunteers year-round to help do what we do. So I was just thinking, what can we ask of our volunteer community right now? So I think that whatever you can do to support your local direct service providers is so important because they're the ones with the links to the most vulnerable populations. So whether that's Amazon supplies to your local direct service provider or sending monetary donations, it's so important because these nonprofits still have a staff to support and, of course, above all, a broader community that relies on them. So I was just trying to get creative today, and I was thinking, well, what if you're a yoga teacher and you can't, you have to close your studio now and you don't have an income and people are obviously going to be missing your class, You could do a course online and then people feel like, well, I'm still financially supporting this small local business. If you are financially stable and you have some sort of interesting certification or education like that, doing a course online, like yoga, like a meditation thing, something like that, that provides health and well-being to your community, but maybe also could raise some funds for a local charity organization. Another thing is, since, of course, all the bars and restaurants are closed, maybe having a little happy hour gathering with some of your friends online, and whatever you would have spent on coffee or on beers at the bar, you can send to a local organization, Utah Harm Reduction or the food bank, something like that. So those are some things that I was thinking about today. So I do think that people generally want to feel useful, and that it's going to be really important to provide people with ideas. And so Sandy's course sounds actually really exciting to me, and I'm glad USU is going to be providing that.
I also, along those lines, this is Heather, I heard an idea too of, since all the restaurants are shut down now, if you can in Salt Lake County at least, if you can still, go or order online or just pick up a gift card for a restaurant and then use, so that they could get the money now and then you could use it later when things calm down, if that's a resource you can have. But I also really love the idea of looking at the money you're saving from maybe not eating out, still reaching out and connecting with your friends, and setting that money aside and giving it to nonprofits or places that may need it, as well as thinking of ways to support our local businesses that many times employ some of these vulnerable populations.
So I also want to say that the situation we're finding ourselves in was not inevitable. So everyone will have to forgive me for being a sociologist for a moment, but I think this is also a time for statewide and national reflection about how we created a situation where we don't have enough hospital beds for people who need it, where in some places, in many places still, people are unable to access the testing that they need. In other places, it depends on your insurance provider if your HMO is covering that right now. I don't think any of the things we're encountering are inevitable. I think that they're a reflection of our decision as community members about what we prioritize and where we choose to put our funding and our support and what we really believe in. And as we watch this play out, everything that we're saying on this podcast today, some of it may quickly become outdated. Just last Friday, our governor asked us to decrease contact to groups that were sized 100 or smaller. And today, our president asked us to decrease contact to groups that are size 10 or smaller. And by and large, public health experts are recommending all of us who are able to self-isolate do so. So some of the facts that we're presenting are going to become out of date very quickly. But the larger question of how we ended up so ill-equipped to face this is something that I think we really need to think about. And we need to think about what we believe in, because right now we've built a system that is based on if you don't have a job, you likely don't have access to health insurance. A lot of people are in a position to lose their employment, at least temporarily. And unfortunately, we don't have a lot of great backup plans for that. Countries that do have universal health care, which I'll point out is every Western industrialized nation except for us, are struggling to face this, and they're not excluding anyone from care. The thing about this virus is when we exclude anyone from care, literally anyone, that person is just as much of a vector as someone who is wealthier or has a better job or a nicer insurance plan. So when we think about public health and we think about viruses that don't discriminate, I think this is a time for reflection for all of us, because we have created a system of haves and have-nots with regard to medicine in our state. And from a scientific viewpoint, from a public health viewpoint, that doesn't serve our public health interests, and it costs us all a lot in the long run to decide that we are unwilling or unable to provide treatment to some people, especially in a situation like this. So as these facts possibly shift or the guidance shifts, I just want everyone to still keep that question in their mind. You know, we're talking today about harm reduction. We're talking about vulnerable populations. And I think that's a really important conversation because we've set ourselves up to have some incredibly vulnerable populations who are going to lack needed resources during this time. And the nature of a pandemic is that no one is safe while one of us is not safe. And so this is a great time to think about what are our values and are we really handling this thing the way we want to be handling it. This is not really a pitch for any specific policy or orientation, but looking at public health evidence, it's really important that we consider the least among us in our policies. If for no other reason, if you as a human don't believe that the least among us is worthy of services because they don't work hard enough or have a good enough job or an address, I personally disagree with that belief, but you're entitled to it. But for no other reason than all of us are linked together. All of us can become sick. And if we don't take care of the least among us, that affects everyone. And so I also wanted to ask a question of this group. I wanted to know if you guys have seen, it's even hard for me to say this out loud, but have you guys seen information being passed around about how this pandemic will be good, about how only the strong will survive? I'd like to know your thoughts.
This is Heather. I haven't seen anything like that. I've tried my best to jump into social media or other things only to check in on my friends and not get too absorbed in all of it. But I think I love the points that you made, and I think that I hope the good that comes out of it is that we do have that reflection, that we do look at ways to be better prepared. I read an article that talked about how this has really exposed a lot of those things that we've tried to hide or sweep under the rug or say weren't a big deal or whatever, that it's really come to the forefront. And like you said, whether you quote-unquote believe in something or not, it still affects you. And it affects everyone because we are all intertwined. And so to look at how can we just strengthen that fabric of our community rather than always trying to grab and take away. I think the people hoarding at the grocery stores is kind of a good example of some of that panic that people have about I've got to look out for me and not thinking about others. And it's understandable and it's a ripple effect. But I hope that in the long run that we will look at this on how can we better take care of everybody, and that ultimately takes the best care of ourselves.
Thanks, Heather.
Yeah,
Hillary, do you have any thoughts on Sandy's question?
Oh, yeah. So I haven't heard anything about regarding Sandy's question. I have not heard those sorts of very stigmatizing and, in my opinion, unuseful at best thoughts in terms of only the strong will survive. I haven't heard that. But what I am worried about is that, and I guess this is sort of in line with what Sandy was saying. I'm worried that there eventually might be blame or scapegoating upon the people who have the least defenses, including, again, people who are unsheltered, people who use drugs, and sex workers. I'm very worried that they're going to feel even more stigma from society than what they even experience on a daily basis. And I surround myself with colleagues, and generally, my family and friends are very empathetic to the cause of harm reduction and to the greater welfare of communities, as Heather was talking about. But yeah, I guess time will tell how these vulnerable populations are seen. Even though, as Heather mentioned, it's the middle and upper middle classes that have been, that we've seen very publicly and egregiously violating the suggestions regarding precautionary measures like social distancing.
Yeah, it's just unfortunate that, those who have less resources available to them, are getting the short end of the stick in some regards here, and, aren't able to go to the grocery store and buy things in bulk if they feel like that's necessary, or, might not have access to the same resources. But that's why we're having this podcast, because we want to, we want to do exactly what Sandy said, and we want to lift where we stand and help people in our communities and not forget about those people who are marginalized or who are underserved. So,
yeah, I think there's I think there's an opportunity here as well to call out Utah and, really express, we're in a great state to be in, those of us who are here. There is a tremendous amount of social solidarity in general. Our state began taking measures before many other states. It's been very proactive. I recognize that the economic impacts of many of these decisions are going to play out over the coming months and potentially longer. But I just want to give a shout out to my fellow Utahns. I moved here alone 3 years ago, and I have to say I've never lived anywhere where I have been so taken care of by my neighbors at so many different points in time. I think that's something that this state can be proud of. We are one of the top volunteerism states in the country. I think this is a moment for us to shine as a community, for us to be a model for other areas, for us to show people what it means to care for your neighbor like yourself. I think, we have to give each other a lot of credit for how different social institutions ranging, from churches to nonprofits, have been mobilizing very quickly and very earnestly to try to do their best to respond. And so I think even as we're talking about potentially racist beliefs or other things that we've seen that don't make us feel great, it's also a great time to acknowledge that there's a lot of good stuff happening. And on our Twitter feed, on our podcast feed, we're going to be here doing our best to continue providing you with up-to-date information as it becomes available. But we're also available as a community resource. So if you hear a myth or something you're not sure if it's a myth or not, if you have a question, I'm a professor, and we have that famous expression, there's no such thing as a stupid question. If you have a sincere question, we're going to be available to answer it through that social media channel. So we encourage you to reach out because we'd love to be part of the social fabric as well that's trying to respond locally and globally to meet our needs. So if you're not sure what to do, if you're not sure what a current regulation or recommendation is, if you've heard something somewhere in the depths of the internet, please feel free to reach out. One of our services as a cooperative extension system is that we provide unbiased, evidence-based information. And at this moment in time, even though our podcast is primarily focused on harm reduction related to drug use, that includes COVID-19. So this is a standing invitation to community members far and wide to utilize us as a resource, and we're happy to be of service.
And you can find us at debunkedpod on Facebook, Instagram, and Twitter. On those social media platforms, we will have posted the website to WHO and everything that the World Health Organization has to say about coronavirus, as well as what the Center for Disease Control and Prevention here in the United States has to say about coronavirus, and the Utah Department of Health website for that as well. We also will post a fact sheet about COVID-19 and opioid treatment programs, which is made available to us from the Mental Health and Addiction Services. So we're going to have all these resources up for everybody because, like Sandy said, in Utah, we're doing the best we can, and we are doing a good job. So we can be proud of that. And we're going to get through this. We're all going to get through this. Thanks, everyone, for being on the show today. Does anyone have any last-minute burning thoughts they want to share?
This is Heather. I just want to say one quick thing. I think along with what Sandy said about asking questions, I think it's a good opportunity also to provide suggestions or ideas or support, things that maybe has helped them. I've seen people offering online art classes for kids for school to keep them busy, things like that. So I think as well as asking questions, maybe answering some as well, part of that community.
Yeah, thanks. Hillary, do you have any last-minute thoughts?
Yeah, I think just stay on the lookout for ways that, you can share whatever emotional support you can provide or professional expertise, creative knowledge, try to stay attuned to those talents or gifts that you have, and seek new ways of sharing them in this time. And again, do some research on what's going on in your local community and find ways to support your vulnerable populations.
Yeah, if everyone makes a commitment to check in on 2 people a day who might need it, there won't be anyone left who needs someone to check in on them. So if we all set that goal, that's the greatest expression of community that we can come up with to respond to COVID-19.
Thanks. Today, we were joined by Dr. Sandra Solzer, Heather Bush, and Hillary Desch. Each new episode launches on the second Wednesday of each month. So join us on April 8th when we debunk the myth that addiction can be cured by willpower. Debunked is produced in collaboration with Utah Public Radio. Funding for the show comes from the Substance Abuse and Mental Health Service Administration, the Office of Health Equity and Community Engagement, and Regents Blue Cross Blue Shield. Our editorial board is Jay Hymas, Adam Baxter, Ashanti Mortiz, Savannah Ely, Dr. Sandra Solzer, Dr. Suzanne Prevedel, Dr. Erin Fanning Madden, Mindy Vincent, Patrick Rizak, Michelle Chapus, Dr. Maren Voss, Dr. Amy Kahn, Tricia Glass, Lloyd Arrive, and Hillary Desch. Debunked is produced by Nick Porth, Shalane Smith Needham, and Friend Weller, with Nick Porth serving as lead producer. Our creative specialist is Autumn Gibbs. Music for today's episode was created by Nick Porth. Our science advisor is Dr. Erin Fanning Madden, and our program directors are Dr. Sandra Solzer and Dr. Suzanne Prevedel. I'm Tim Light, host and editorial board member. You can find the show on the podcast app, Spotify, upr.org, and anywhere else you get your podcasts. Check us out on Instagram, Twitter, and YouTube at debunkedpod, or on our website at bit.ly/debunkedpod.